to lose this ability. This is just showing actual studies on crystallized intelligence and fluid intelligence. All right, so how can we keep our mind sharp as we grow and age? Well, we definitely want to try and have a challenging hobby or life passion. Okay, so this is one thing that we do tend to highly encourage teenagers to try and get some sort of life hobby passion that they enjoy and continue that on through adulthood. When we get into our later years, you'll see that having a hobby can really get an older person through some major life events. So we want to try and do this, okay? Try and stay passionate to learn new things, you know, expand your career if you can, or try and always push yourselves to educate yourself. Try and, you know, challenge yourself. This over here is, you know, if you have to use calendars and sticky notes and things like that, that's fine, right? If you need to leave notes for yourself, if you need to leave reminders, set alarms to take your medication, that is okay, right? We are not perfect. We're not going to remember everything. So using certain methods to prompt yourself and remind yourself is absolutely okay. This is an adult stage, a theorized adult stage for Piaget's theory. He would call it, you know, post-formal thought. For adolescents, he had formal operations. And this is the idea that maybe we could go beyond that and say we have post-formal thought for adults. This would be just a more fluid idea, I guess, from intelligence, you know, being able to take different perspectives, make decisions based on your gut feeling, and always being interested in exploring and finding out new information. We have some adults that are like this. We think of them as very wise. We go to them for advice. Okay, they might say things that you've never thought of before, or they challenge you. We also have plenty of older adults who do not show this. They don't change. They are still set in their old mindset. You can't change their mind about things. So, you know, this is definitely theorized that maybe some adults have some form of post-formal thought. Midlife, you start to see the role of the grandparent come on, right? In midlife, you're, you know, 50s, your kids are probably in their 20s or 30s, and they might start having children of their own. Grandparents serve an important role in families. They step in to help out if there's a crisis. They act as mentors for the family. They can be a mediator if there's a family dispute. We also know that they tend to really step up the role of watching their grandchildren, okay? We have more grandparents serving as daycares nowadays than we ever had before. Obviously, you know, if you are a mom or a dad yourself, you know that the grandparents can sometimes overstep their boundaries. They can maybe be a little bit too involved, or, you know, they can run the line of just being, they spoil the grandkids, they don't raise the grandkids or discipline the children like you might. And so this can run into some problems. It can cause difficulties between the parents and the grandparents. You know, you want to be careful with this, obviously, and I don't know, I guess just navigate that the best way that you can. Grandparents obviously always have run the risk of being cut off and not having access to the grandkid if they become too much. So divorce obviously can impact. Usually the female keeps the child, and then therefore the mom's mom is way more involved. When the dad is divorced from there, very rarely do his parents get to see the children. So that can have a big impact. Oops. Okay. Um, you know, a parent care. So this is the other end of it, right? While we have grandparents that are maybe helping us watch kids, we also have to consider that our parents are getting older. And so this mom here is also maybe going to have to start watching her mom. Okay, so parent care. This is something that you really young ones don't have to worry about, but it's something that should be in the back of your mind at some point. What are you going to do with your parents? It's a highly stressful role. It's very hard to care for parents. It's usually performed by daughters. Of course, whoever is closer to that parent living in the same city will probably take on that responsibility. Um, we call them the sandwich generation. If you are still raising your own children and now you're having to take care of your parent, you are sandwiched in between being responsible for these two different groups. We see this more and more now because our older people just live so long now. A long time ago, people passed away. They died a lot sooner. Now, we can keep people alive for a long time. And in fact, right now, the fastest growing group of people are elderly over the age of 100. That's where we're seeing the fastest growth, and that's a long time to live, most likely disabled in some way, or reliant on someone to take care of you because Alzheimer's or dementia or frailty. Also at that age, they're usually quite poor because they've run out of their retirement. So it creates a stressful time for the children who are now having to worry about how are they going to take care of their parents. When we look at body image and sex and for our midlife, most midlife people feel pretty good about themselves. In fact, middle-aged women are more confident in their bodies than actually their, 20-year-old counterparts. So girls, enjoy the body you have. Don't hate on yourself so much, but know that when you get a little bit older, you're going to feel more comfortable with yourself and more comfortable in your own skin. Sexuality. So women reach their peak generally in their 30s. Of course, this could be extended a little bit later into their 40s. Physiologically, there's few changes, but for the most part, our middle-aged women are not having sex due to just not having a partner. Divorce rates are high, and usually the men remarry someone younger, and that leaves the wife looking for somebody to be with. We also know that men die off at higher rates than females. So it's likely that a female has either been divorced or her partner passed away. So older women outnumber single older women outnumber single men 4-1. Okay. Men, their problems that they're going to have is mostly trouble getting and keeping an erection. This is why we have Viagra, Cialis, and Levitra. They definitely might have problems having sex more than once a day. And so these problems, you know, can be solved by a pill nowadays. So women undergo menopause, and this doesn't necessarily stop sexuality, but it can have a few problems. So obviously, to be in menopause, you have to have stopped menstruation for a whole year. And there's different stages. Perimenopause is when a female is right before menopause. So ovulation may be a couple months and then nothing, and then a month and then nothing, and so on. Postmenopause is after. So after that full year, we now call a woman postmenopausal. And here is where you're going to have more of the sexual consequences. So what really happens is because of the lack of the functioning ovaries, she has a decrease in estrogen and, you know, various hormones like that. So she might have a loss of lubrication and a loss of elasticity of the vaginal walls, which could just cause painful sexual experience. She can also have a loss of effect on desire that's directly linked to testosterone. So many women, once they undergo menopause, can undergo or take hormone replacement therapy. So they can kind of put back some of that estrogen and testosterone and so on. You know, trying to stay passionate about sex, you know, understand men that slowing down is normal. Of course, try and stay healthy because this can directly improve your sex life. Explore treatment options, right? Obviously, Viagra, testosterone replacement, things like that can help men. This sentence right here really bothers me, that we do this for women. Stay sexy. This is even a female that wrote this book, and it just bothers me that she does this. But you know, we could say for men, we could say for men too, that he should try and, you know, stay sexy too, right? But I understand what they're saying. You know, women, try and feel good about yourselves, try and find a partner who values you. You know, definitely consider lubricants. This can help sex and pain, and hormone replacement therapy. But really, both of these could be combined into just anyone who's aging. Women, stay healthy, right? Explore treatment options. Understand that there is going to be some changes. Men, stay sexy. Men, find a partner who values you. And, you know, consider lubricants and hormone replacement therapy. So I don't like that this is divided up like that for men and women. And that is it. So our exam is will open, I believe I scheduled it to open early for you guys tomorrow. It'll stay open through Sunday. It's covering chapters 9, 10, 11, and 12. This was 12 right here. If you have any questions, email me. You can always send a message in Blackboard or post